Welcome back to the WHHI-TV Daily News. Joining me now is Dr. Ardra Davis-Tolbert, and she is with Novant Health, and they have recently acquired Coastal Carolina Hospital. Doctor, I know we have a lot to talk about today because there's a lot of new things going on, but I think we want to specifically focus a little bit about the fact that you did acquire Coastal Carolina Hospital and that you've just opened a new operating room. Tell us a little bit about that.
Yes, so I am again Dr. Ardra Davis-Tolbert. I am the chief of the medical staff at Coastal Carolina Hospital, and we have now joined with Novant Healthcare System. And a part of our venture has been adding a fourth operating room at Coastal Carolina Hospital. You know, the Lowcountry community has grown significantly and is still growing.
Yes.
And so adding this fourth operating room has given us the opportunity to kind of grow with the community, to continue to be able to offer our surgical specialty care right here at home without people having to travel further away for the same care.
Right, and I know that's very comforting to people, is being
Yes.
able to stay closer to home for procedures. Tell us about the cost of the expansion, and I know part of that investment was a robotic surgical system. So tell us a little bit about the cost, but then that investment as well.
Yes, the expansion project was $9 million, entirely self-funded by the organization. And included in that was adding a second Da Vinci robot. So we have the Da Vinci Robot XI system. That's the most advanced system. This gives us the opportunity to continue to offer, again, expansion of our robot services, which incorporates the departments of surgery, general surgery, urology, and GYN.
Well, very impressive that it was self-funded, so congratulations on that. And of course, having the surgical systems is just technology moving forward. So what types of physicians are you seeing primarily using the new robotic surgical system and the new operating room?
Right. So the operating room has been designed to accommodate that second surgical robot, but it is also an operating room that is built to accommodate any specialty, any surgical specialty that may need the room. So it's predominantly dedicated for the robot, but it is equipped so that any other surgeries that need to take place non-robotically can also occur in that same room.
And what are some of the surgeries that can be done robotically?
Absolutely. So a large number of general surgery cases are now done robotically. Examples are like removal of the gallbladder, removal of the appendix, really big bowel surgery that in the past would have required big abdominal incisions are now done through these smaller incisions associated with the robot. In the same token, our Department of Urology also is doing predominantly most of their cases. Some of this is bladder surgery, kidney surgery, some cancer-related surgery, some non-cancer-related surgery with our urology department. And in the Department of Gynecology, which is my department, we are doing hysterectomies, we're removing fibroids, myomectomies, we are doing surgery on fallopian tubes and ovaries, again, with the benefit of our robot being they're smaller incisions. The smaller incisions usually lead to a faster recovery.
Right. Yeah, that is so great. I know that that's, again, comforting to patients that they're not going to maybe be going through the recovery that they thought they would have to by using this new
Yes.
technology. That's fantastic. And so are you looking to continue to grow the number of physicians that you have at your facility?
Yes, absolutely. So again, our community is continuing to grow. Novant has been very supportive in helping us to keep up with the needs of our community. We have added two surgical specialists to our team right now. We have Dr. Stephen Tees with the Department of General Surgery. We have Dr. Paul Malau with Department of Urology. There is a group of orthopedic subspecialists that have also joined our independent orthopedic doctors in expansion. And of course, we're looking forward to what the future holds because we are expecting continued growth.
Absolutely. Of course, the Lowcountry just continues to explode in growth, so that's just
Yeah,
going to continue. So, Dr.
yeah.
Davis-Tolbert, thank you for being here today and sharing with all that you are doing out at Coastal Carolina. It sounds fascinating and really great for the community.
Thank you, and we look forward to continuing to provide our excellent care to our community.
Thank you again.
Thank you. Bye-bye.
And we'll be back in just a moment with more, so don't go away.